Hi, my name is Alyssa and I'm one of the surgical PAs at the Breslow Center. Preoperatively, a lot of patients ask whether or not a drain will be required, and postoperatively, a lot of patients ask how to take care of it. So today we're going to go into both of those things. So the purpose of a drain is to help prevent fluid accumulation within a body cavity. For example, we would want to prevent a seroma or hematoma. So this is the close-up of the drain, and this tubing here is what goes within the body, and then this bulb here is what collects the fluid. So for example here, we just used apple juice. In your case, the drain would be full of serous fluid. Serous fluid is kind of yellow or pinkish looking, and that is normal to see within the drain bulb. Now we're going to talk about drain care. This is a drain log, which we provide each of our patients, and so typically we'll have patients document the date and time and the amount of fluid they find in the bulb at that given time. We will typically have patients document the drain output twice daily, once in the morning and once at night. The first thing we're going to talk about in regards to drain care is stripping or milking the drain. I always recommend using an alcohol pad because I think it makes stripping the drain a little bit easier, but essentially you'll want to pinch the drain where it's coming out of the skin with one hand, and with the other hand you'll take the alcohol swab and push on the drain tubing and pull it down. You're going to feel like the drain is being stretched, but it's important that you keep really good grip where it's coming out of the skin to avoid any pain or any tugging where the drain is sutured into the skin. You'll go all the way down the drain tubing like this until you get all the way down to the bulb. And the purpose of this is to capture all of the drainage into the bulb prior to emptying it out into the medicine cup to measure. So the next thing we're going to do now is empty the drain. Typically these are held to suction, but this one, just for show, it's not held to suction. This is actually how you know it isn't held to suction, because it has the round appearance of the bulb. When they are suctioned, they'll look a little bit more like this. They'll be kind of squeezed together like this. So after opening the top lever here, the drain will lose suction. You'll then empty the drain into a medicine cup. You'll want one that has measurements on the side here so we can accurately measure the drain output. And we'll do this typically twice a day. To put the drain back to suction, which is how we'll want the drain each time after you empty it, you'll simply squeeze the bulb and then close the lever.